Welcome to Pregnant Tea, your cozy corner in the world of pregnancy, where we sip on stories, wisdom, and the occasional cup of actual tea. I'm your host, Kendra Pace from Natural State Wellness. Each week, we brew up candid conversations with mothers who've walked the path you're on, sharing their triumphs, challenges, and everything in between. We also invite professionals to spill the tea on tips, tricks, and techniques for each stage of pregnancy. We'll be talking about everything from prenatal care to postpartum recovery. So whether you're a first-time mom-to-be or a seasoned pro, grab your favorite mug and settle into your comfiest chair as we venture into this crazy and wonderful world of pregnancy together. Today on the show, we've got Ivy, and she's going to be talking about her fertility journey and her struggles after coming off of birth control. I'm going to let her take it away.
So I started taking birth control when I was about 14 or 15. I took it for about 5 years. The reason why I was put on it is I had an eating disorder as a kid, so I wasn't getting a period regularly. So they put me on that to regulate it. A year before I got married, I decided to stop taking it and detox from it. As soon as I stopped taking it, I just stopped getting a period. And I didn't get a natural period for about 4 years. So there was a lot of question marks on, why I'm not getting it, what's happening. And I was actually diagnosed with having PCOS, which is Polycystic Ovarian Syndrome. So that's been a little bit of a battle dealing with. And there's some research that says that it can correlate with being on birth control and the after effects on being on it for so long.
Did you feel when you got that diagnosis, was it relief? Was it a mixed bag of feeling good to finally have something to pinpoint it to, or was it just more frustration?
I feel like it was really upsetting because the doctor that I originally saw, she said, I think that you might have it, and was nonchalant about it. So it made me upset because she was like, oh, you might just have a hard time having kids. Just acting like that was no big deal.
Mm-hmm.
So it was pretty hard. I don't know if there was any clarity. I think it was just that I knew there was going to be a hill and some struggles I had to overcome.
And you were really young when you had this diagnosis. How old were you?
I was 20 when I got diagnosed with it, which, I was pretty young. Being 20, you think that you're super fertile and you're not going to have any issues having kids, but that changed pretty quickly.
Once you got the diagnosis, was your doctor helpful in suggesting next steps, or did you find you had to do your own research? What did you do?
So the doctor that told me that she thinks that I had it, I just didn't have a good vibe from her. I felt like she just didn't really understand things. And, I had gained a bunch of weight, and she just kind of said it was based off of my age, and just kind of put me in a different category, which made me feel like I wasn't being heard. So I ended up finding a different office to go to. And once I started seeing them, that's when I officially got diagnosed with it. And they were just a lot more understanding, and they gave me different options that they had recommended that I do. So I felt like I had a little bit more information from them than I did from the other doctor. I also did my own research and talked to different people about it. I know you can't put all your eggs in one basket, so you kind of have to advocate for yourself, I would say.
Definitely. And so what were the steps, just for people who don't know too much about PCOS, who was the provider that you went to see to give you the diagnosis? And was there certain procedures or tests that they did to decide on this diagnosis?
Yeah, so I went through the gynecologist, and what they did is an ultrasound. They're looking at your ovaries to see if you have cysts on them.
Mm-hmm.
They say it looks like a string of pearls. And they did a bunch of blood work, which showed that some of my levels were not where they should be. Testosterone, insulin, things like that can all be tied into the PCOS.
Mm-hmm. In doing your own research, you said that you had joined some groups of other women with that. Did you find that really helpful to have that camaraderie and having these women going through the same thing. Would you suggest that for other people? Did it feel for some reason more isolating?
I definitely did find it helpful hearing other people's stories, what they were experiencing. I think what was hard for me is that the symptoms that I was experiencing, so everyone has different things that they're feeling. Some people with PCOS, they might just skip cycles. Every couple of months they get a period. Whereas me, I just didn't have one at all. So sometimes there would be moments where I felt kind of isolated just because not everyone was dealing with that symptom like I was. But it was nice hearing their stories.
And did anything in those groups push you to go do more research? What were next steps for you?
So I know a lot of people were saying diet, that's really something that you want to dive into. So a lot of people in the groups, they said that they went dairy-free, gluten-free. They were working with natural doctors. Some of them were taking letrozole, Clomid, which can help you ovulate to potentially get pregnant. So I felt like that was helpful, like hearing other women doing those things and noticing the difference. But it wasn't until I actually did it that I started noticing changes.
And so, along with working with your gynecologist, you also worked with a naturopath for some of this. So what route did they take?
So we did a lot of supplementation. A big one was just avoiding foods that are going to cause inflammation. So for me, I have dairy, soy as a sensitivity. So I cut dairy out of my diet for the most part. And then soy was a little bit harder. But the dairy, I noticed a huge difference right off the bat. I used to get asthma, and that helped get rid of it, which was pretty cool. A lot of the supplementation, so different supplements, herbs, things that help get things balanced again.
So he took a really personalized approach with you, right?
Yeah, exactly. Like looking at my labs, looking at different things to me specifically rather than just putting me into a category.
So when you figured all of this out and you started implementing lifestyle changes, what things would you coincide? Like you'd been doing it for 6 months. What changes had you started to notice?
So a big thing was, cutting out the foods that cause inflammation. Before, my A1C was pretty high, which people with PCOS, they have insulin resistance. So for me, I was in the pre-diabetes category. So after changing my diet, trying to exercise, my A1C now is a 5.3, which is like a great range to be in. That was a big change that I had noticed just from food. And then just working on mindset, that's a huge one. That's not something that's very easy just because going through it, you're facing lots of hard answers and hard decisions, but just doing the best you can to keep a positive mindset is important. I actually started doing acupuncture, which I felt really helped push me over the mountain there.
How often would you say you were going back to your regular doctor to have, like, I know that you had multiple ultrasounds, multiple blood tests. Like, how frequently would you say you were going back to do that to test your numbers? Because you still, even once you started this process, you still didn't get a natural period throughout, right?
Right. So the only time I've gotten a period is usually by medication. So taking a progesterone pill to activate that. I did take medicines too that made me ovulate, and that was the only time that I did end up getting a natural period, was just once after I ovulated. When I was taking like different fertility medications, I was going to the doctor at least once a month for ultrasounds. The blood work is just one of the things that they didn't really check up on a lot. I found out updated results if I requested things or when I had my yearly follow-ups. So that's what's hard about going to the OB, because they're not tracking things every time you come in. If you went to a specialist, they're going to do that. They're going to really dive deep into it. But unless I requested something, usually they wouldn't do it unless it was an ultrasound.
And then you would your naturopath would cross-reference these.
Exactly.
Right?
Yep.
And then was there any tests we're in New York State, and New York State is really difficult to get testing, even for naturopaths. Well, alternative testing, I should say. Did he request any?
There's just certain things that he would suggest, like, hey, maybe we should look into this. Maybe talk to your doctor, see if they can do a blood test for you. Just because since being in New York State, he's not able to, order anything. So he would just recommend something, and then I would talk to them about it.
Were they pretty good? Would they just be like, okay, yeah, let's run that?
So sometimes they would be like, well, I don't know if you necessarily need that. I don't know if it's going to show us a whole lot. But I would just tell them that I just want to do it. And they would just end up calling it in. But anytime I would get blood results back, sometimes they wouldn't go over it with me. I would have to go over it with a naturopath or with the fertility dietitian that I was working with.
Oh, how did that go?
So that went really well. During that course, I met with women once a week. It was 4 of us that were kind of all in the same predicament. And we just really dived into environmental toxins and different foods that empower fertility, what things to avoid, working on stress management, your sleep, how important that is. So everything tied in with each other.
How long was that course that you took?
It was 12 weeks.
And what would you say was the best thing that you got out of that?
I think the most helpful thing was learning how to actually track your cycle. I think growing up, you don't really ever pay too much attention to that. It's just, oh, you get your period once a month. But there's just so many other things to look for, like cervical mucus, your basal body temperature. Those things tell you what's going on with your cycle and where you're at, which it didn't really at first make sense to me not having a cycle. But then when I did take medicine to get a cycle, it all started to click again. So I felt like that was really helpful, signs and symptoms to look for.
The book, The Fifth Vital Sign, saying how your period is showing you so much information and should always be taken into consideration. And I feel like it's not represented enough, the information about our periods. It's almost like an icky situation, some people think, but it's so important and can give us so much information.
I think too, like everyone thinks, oh, I get my period, like I'm in so much pain or uncomfortable, but that's not really normal. It's really not. And I think we just normalize it, but it's not normal.
Right. Like something being common does not mean that it's normal. And
Exactly.
I use that phrase all the time when I have clients coming to me and saying they have this symptom. And I'm like, yeah, a lot of people struggle with that, but it's not normal.
And like your cycle length too. Not everyone has a 28-day cycle. Trying to learn that it's okay if it's a couple days longer or things like that. That just is going to help you each month tracking things.
So what would you say after everything that you've learned today? Let's go from today on your daily routine. What would you say you've added into your life? Like, what's different than before all of this information that you had? What are you implementing? What's your, not what you eat day to day, but your food regimen look like?
So I check my temperature every day. As soon as I wake up in the morning, I don't get out of bed. It's the first thing that I do. And that lets me know where I'm at. That can tell you a lot about your cycle. It could tell you if your progesterone's at a good range. It could tell you if you're about to ovulate or if you did ovulate. So I do that every morning. I eat a nice healthy breakfast. I try and include a fruit of some sort, something healthy, something that's going to make sure that I'm filled. And just trying to avoid the processed foods and fatty foods and trying to eat more balanced meals. Protein, fat, a carb. You don't want to just have more of one thing than another. You want to be balanced across the board. That definitely helps because then I stay fuller for a little longer. But I also just listen to my body. If I'm hungry, it's important to make sure that you're feeding your body and listening to the severity of how hungry you are. Are you hungry because you're bored, or are you hungry because your body actually needs the fuel? So I'm always doing that, trying to make sure I'm staying on top of it. Try to go for walks as often as I can just to get circulation. And the most important thing that I do is go to bed at the same time every day. I don't think people realize how important that can be. Your sleep, the quality of sleep that you're getting, that affects so many things. So I try and go to bed at the same time every night. I try to wake up around the same time every day, just so I'm staying on a routine. That's really important.
The dental office that we worked in together is very busy, and you have a very busy position, basically running the back, having the other assistants, helping them where they should go next, helping the doctors. When, say, the mood strikes where you're really hungry, what do you do to combat that if it's not lunchtime?
What I've been doing is eat a snack, whether it's a protein bar, some nuts, something that's just healthy to have in between. I know that I need the fuel. Sometimes it's easier said than done, but I try and make sure I'm staying hydrated throughout the day. And again, if I need a snack, then I'm okay eating one.
Good. You pause and you take that time for yourself because you know how important it's going to be. So the other thing is you've got your husband, Carrick. So how was this for him? Let's start from the diagnosis and then work to how he helped you, how he was a great partner through all of this, and what you found was most helpful for him to do for you.
When we first found out, we were both upset. We knew that things weren't necessarily going to be easy, but we both knew that we wanted to have kids and we wanted to do what we could do. So he was very supportive, and me taking different classes and me going to different doctors, just trying to do different things to better myself, better my body. And he would cook certain foods for me to make sure I was eating as healthy as I could. And when I went through the dietitian program, he actually would sit with me and listen in and kind of take mental notes too on what he could do to help me. So I felt like that was really helpful, us having that hour a week where we could just trying to figure out what we're going to do next. That was extremely helpful, and it really showed how much he was invested in it as well.
Yeah, he's a great partner and a great cook.
Absolutely, thankfully.
When you felt comfortable enough to tell family members or friends about your struggles in going through all of this, what do you think was most helpful for your friends or family to do or not do?
I liked when, some people, and this is in everyday life, some people are very supportive and other people have their own opinions. I felt like what was really helpful is just kind of understanding where I'm coming from, what I'm dealing with. I think what was really hard is people saying, well, oh, my aunt did this and they're pregnant, or they just stopped thinking about it and got pregnant. All of those things aren't easy to do when you're going through a fertility battle. You're going to be thinking about it. You're going to be worried, concerned. And those things don't necessarily impact the ability to get pregnant. It's okay to have those feelings. Sometimes people just don't really understand that. They think that everyone's the same. What worked for someone else is going to work for the next person, but that's not true. Everyone's different. Everyone's body's different, does different things, different symptoms. So I felt like the people that would be like, oh, Ivy, I'm so sorry you're going through that, and just try and hear you out and say, I understand that it's probably so hard for you to go through that, resonated with those people a lot better than the people that were like, oh, my grandma got pregnant with triplets and it's going to happen for you. But it's not the same. Hearing that doesn't make me feel better.
Right. Were there any valuable articles you read or books you read or podcasts you listened to, anything that you would suggest for other women going through this, whether it's the mindful piece or information that you can implement into your life?
I think taking the fertility course, that helped me so much with learning how different foods impact different phases that you're into. So you have different phases that you go through during your cycle and what food supports that phase. That was really helpful, knowing what things are going to help at that point in time. I think diving into everything and doing your homework on everything. Don't just stick with one thing. I feel like you got to look at all the different things that you can, just because everyone's so different. Everyone has different things that they're going through or struggling with. But food, working with natural doctors, the acupuncture, all of that's tied in together. And don't just listen to one person. You got to listen to yourself and you got to do your own homework. I don't know if there was necessarily any articles that I read. I think meeting with different people and hearing their opinions and resonating with what I felt was going to work best for me.
Mm-hmm. I feel like that's great advice. Finding what resonates with you best is one of the greatest things we can do. And it's such a lost art because I feel people are so used to going outside of themselves to look for information, which you're doing in a way, but you're also making sure that these practitioners or people that you're working with, it sits with you right, because the first doctor that diagnosed you didn't feel comfortable there, so
yeah, exactly.
you went on to a different one and you clicked with them. And I think for people to have that reminder that you don't have to stay with this person, you can kind of shop around, is okay until you find the person, which can be a frustrating thing, finding someone that actually makes you feel heard.
Yeah, absolutely. I think we can just get so caught up in just listening to what everyone's saying. But if you took everyone's opinions, everyone is so different, So at the end of the day, you just have to listen to what you want to do. Especially with fertility, it can really dive down the rabbit hole. Like, oh, you need to do this, you need to do that. I had a friend that told me I needed to eat a nut a day to help with my fertility. And she's like, I think that would really help. But if I did every single thing that everyone told me to do, it would probably do more harm than good, just because you can't overdo it. You have to do what's going to work best for you.
Right. What fits into your lifestyle. I mean, obviously you're going to have to change your lifestyle to some point to see a difference, but that's so true. You can't do everything, because that would just increase your stress and negate every good thing that you're doing. Absolutely. As far as mindset, what helped as far as navigating the real low lows when you're getting excited, like, oh, maybe I'm going to get my period this time, and then you don't? What helped you persevere through all of this?
I think talking to people helped a lot. I started seeing a therapist and just really putting that stuff first. Sometimes you get caught up in just bottling it down, but really talking about it helps a ton, getting it off your chest and really talking to someone and sitting in your feelings for a little bit and why you're feeling like that and how you can help with it. My dietitian, she would give us things that we could do, whether it's a journal prompt or something that you could do in your free time. Take a couple of minutes and picture yourself getting pregnant or picture yourself getting your period, things like that, positive things, trying to put that in your mind. I felt like all of that stuff is very helpful rather than just sitting and staring blankly, which is okay too. It's okay to sit and be sad. That was something that I had to learn. It's okay to be upset, but also just writing out things and trying to think about the future in a positive way, that helped too.
Anything else you'd want to say either to women who know someone that's struggling with fertility or a woman who's going through the same thing as you?
I think if you know someone going through it, just be gentle, be cautious what you say, how you say things, because it's hard to know exactly how they're feeling. And you really listen to, if they want to talk about it, really listen to what they have to say, but be, mindful that it's really hard for them to go through it. As far as being someone to go through it, I think just talking to people, and for a while I felt like, oh, why am I bothering telling people? But you have to kind of preach things a little bit for people to really understand what you're going through. I had grandparents that said, oh, when are you going to have a baby? Saying those things can be a trigger to people going through it. I would just not say anything, or I would get upset and sit in my own feelings. But I started speaking up and saying, I want that for me too, but it's not something that is going to happen right away, or it's going to take a little longer, or educating people because people don't always understand.
That's great advice and a good reminder for me to listen to too. Well, thank you for sharing with us.
Yeah, no problem.
I know it can be a really delicate situation to talk about, but I think it's going to be helpful for people. I'm really looking forward to following your fertility journey and seeing where this goes. Hopefully you'll keep us posted on any good things, bad things, whatever you want to talk about in the future.
All right. Sounds perfect.
Thanks, Ivy. Thanks for tuning in on Pregnant Tea. I hope you've enjoyed listening to wisdom from our community of mothers and experts. If you want more relatable stories and empowering advice, head over to www.nswellness.net to subscribe for the latest content. Until next time, take care of yourself.